Thank you for yielding to me. And I really want to thank my colleagues on the other side of the aisle, and in particular my dear friend John Moolenaar, who we've been a team on this from the moment that we heard about this. I rise today to share my strong support for H.R. 7188, the Chandra Azenga Human Cell and Tissue Product Safety Act. And as we've talked about, I'm very proud from the moment we were notified from a public health department of what had happened. My colleague, Mr. Moolenaar, and I went to work on this issue. Last summer, I was contacted by the medical director of the Washtenaw County Tuberculosis Clinic, who was treating a patient, Chandra Azenga, for a severe post-surgical tuberculosis infection. Chandra was Representative Moolenaar's constituent, but she was being treated at the University of Michigan, a medical facility in my district. And after a month battling a severe TB infection in the intensive care unit, she unfortunately died. Since Chandra's passing, it has been discovered that her death was indeed linked to contaminated bone graft material produced by Aziyo Biologic. She was one of 36 patients who received material from the contaminated lot, and as of today, this latest outbreak is linked to the deaths of 2 patients, including Chandra. This bill requires the Department of Health and Human Services to conduct public awareness campaigns to assist in preventing TB outbreaks caused by contaminated human cell and tissue product donations. We've also included an important provision to allow the Food and Drug Administration to pursue civil penalties from establishments that manufacture human cells, tissues, and cellular and tissue-based products where they put the patient at risk. Patients and their healthcare providers deserve to know the risk associated with tissue donations, and companies that make and distribute contaminated products must be held accountable for their actions that put patients in harm's way. I will actually tell you, when this happened, I had had multiple bone grafts because of osteomyelitis. And when I called I never once was warned of any danger, and my doctor was unaware of these dangers. We cannot let that ever happen again. We must protect patients and educate patients. I thank the Energy and Commerce Chair, Catherine McMorris Rodgers, and Ranking Member Frank Pallone for fighting for this important piece of legislation. And again, I would not be here without my colleague, Representative Moolenaar. We owe it to Chandra, her family, who are all here, who we made a commitment to last August. We would not let this happen to anybody else again. So I am happy that they see us here fighting for them on this floor. And any other patient who's been affected by contaminated bone grafts, we're here for them too. We are going to prevent these unnecessary tragedies from happening again. I urge my colleagues to vote yes, and I yield back the remainder of my time.
The gentlelady yields.